Hi, I'm Dr. Barborka with Summit Dental, and today we're talking about same-day crowns. A reason a patient might need a crown would be if you've had multiple fillings. A lot of times we see patients that have had 1 or 2 or 3 different fillings placed on a single tooth. And there's nothing stronger than your natural tooth. So anytime we add a filling, although it might last quite a few years, it's not as strong as it originally once was. So we see patients all the time who've had 2 or 3 fillings on a tooth or getting fractures on the tooth. And so structurally it's just not quite there. And so a crown basically is a full coverage surrounding structure on the tooth to give it strength and support for many more years to come. Different materials that we offer, traditionally there's like gold and porcelain and other things like that. For posterior teeth, the different forces that are required for those teeth require stronger materials. And there's materials like zirconia, which is very, very strong for posterior teeth. Gold is very, very strong for posterior teeth, but it's not aesthetic. So one of the things we've invested in this practice is same-day technology. CEREC technology allows us to manufacture a crown in-house in one appointment, and it uses those high-quality zirconia materials to give that structure and aesthetics for posterior teeth. As we use our teeth, the food debris and bacteria that are naturally in our mouth produce acid, which causes tooth decay and destruction. That's why you would need a filling, for example. And so the initial process when you get a cavity would be to take the decay out and fill it with a composite material. That's what we call filling. As we get older, and as you get multiple cavities on a single tooth, we're getting more and more fillings, or single surface or 2 surface fillings on a tooth, which ultimately leads to weakening of the tooth. So for teeth that have had multiple fillings or multiple areas of decay, when we don't have enough tooth structure to support the filling, we need something full coverage like a crown to give the tooth actual structure. So with our CEREC technology that we've invested in, it allows us to take digital impressions of teeth, which gives us just as accurate an impression as the traditional goopy impression material. It's a much quicker, much more comfortable for the patient, and it allows us to fabricate our crowns in office in one appointment. And one of the things that we pride ourselves on is treating our patients like family. And I know for my wife, if she had to come to the dentist, it would be 1 appointment is better than 2. And so this allows us to take those impressions, design and fabricate our crowns, and deliver them in 1 appointment. We have lots of patients with busy schedules, and of course if you've been struggling to get into the office or putting off treatment just because it's hard to get time off, this allows us to take care of all of your needs in 1 appointment rather than 2 and spreading that out over a couple of weeks. Again, I'm Dr. Barborka. Hopefully you've learned a little something today about crowns and why they're needed. If you have any questions or need any help from us, feel free to reach out to us. And thank you for watching.